Thank you, Acting Deputy Speaker. And I rise today to speak on the Private Health Insurance Amendment Bill. Deputy Speaker, access to good health and good health care is a sign of a great community and a great health service. And Australia has a proud record of quality health care with our universal access to primary health and a balance between public and private provision. But from time to time, things do go wrong, and having a robust, effective complaint system is an important feature of society. Consumer protections are an important element of any system, Acting Deputy Speaker, and this bill transfers the functions of the Private Health Insurance Ombudsman to the Office of the Commonwealth Ombudsman and is therefore worth careful consideration. Labor, Acting Deputy Speaker, wants a strong health system, unlike what we're seeing currently from the government, which seems not to have clear health policy. And as this bill makes changes to the existing system without careful considerations of the implications and the practical outcomes, this reflects many of the things that we have seen from this government in 18 months in the health space. We've had, of course, changes to the GP tax, too many to count, and still it seems unresolved. We had a $7 GP tax, a $20 proposal, a $5 proposal, and now it seems, by stealth, an $8 increase to patients at the GP. We've had PBS price hikes planned but still not delivered. We've got Medicare locals still unsure of the future arrangement, those things still unresolved. And, Acting Deputy Speaker, we have hundreds of healthcare groups, healthy community programs, not knowing if they will exist after June. In Wyndham, we have the Healthy Together Wyndham program. Now, these programs were particularly targeted to areas in our community with high risks of diabetes and high risks of heart disease, and it was preventative health funding and part of the budget cuts of this government, which seems not yet to have come to grips with the notion that prevention is cheaper than cure. Now, this program in Wyndham, Acting Deputy Speaker, has reached over 54,000 people. That's 28% of our population that has had a positive relationship or a positive interaction with that Healthy Together program that is still in doubt beyond June this year, having been topped up for the last 12 months by state government. So it's in that space that we're looking at this further bill today. We've had short-term extensions to things like the specialised training program, a program designed to train more specialists, particularly in rural areas. So we find ourselves in this health space with uncertainty in the community about how we're going to go forward. And again, we have a bill in front of us that it appears the implications of the bill have not been thought through thoroughly. This government has also, Acting Deputy Speaker, approved the two biggest increases to the private health insurance premium in a decade, 3 times the rate of inflation, bigger than any ever announced by the previous Labor government. Deputy Speaker, a moment's thought would give pause about an unseemly price hike in the current chaos that's being overseen by this government. It leaves us thinking that the Abbott government has no deep commitment to health and no clear direction set in the health space. And the Private Health Insurance Ombudsman exists currently to protect the interests of Australian private health insurance consumers, that is, patients, in the context of health. It plays a vital role. It is in demand and it is very effective. It assists in settling disputes. It identifies underlying repeat problems across companies. Acting Deputy Speaker, it has a monitoring role. It provides data for problem solving. That data should be used to assist in the design of preventative actions. As William Edwards Deming said, Acting Deputy Speaker, in God we trust, all else bring data. But in this instance, this piece of legislation could prove to minimise the government's access to useful data in plans for future health provision. And in a lean operation, the Private Health Insurance Ombudsman provides advice to industry and government about issues and about the sector's performance and common complaints. It's delivering in a growing complaints regime, Acting Deputy Speaker. It produces the annual State of the Health Funds report for more, and has done for more than 10 years, comparing the performance of health funds. It has overseen an increase in complaints, but also an increase to traffic to the website, where patients, customers, consumers can look at the comparative performance of those health funds. And it has seen increased customer satisfaction. It is therefore good quality service, and one wonders why this government would see fit to move the provision from the private health insurance ombudsman to the Commonwealth Ombudsman at this time. Acting Deputy Speaker, the Commonwealth Ombudsman is also oversees an effective operation, but will it be well supported to take on this extra task? None of this is clear in this piece of legislation. Will the specialised staff be lost? Will the corporate knowledge be lost? Will the parameters of the work be maintained? Will the service levels go down? The specialised staff and corporate knowledge are vital in ongoing decision-making in the health sector. And Acting Deputy Speaker, this is in terms of Labor's attitude towards healthcare. We are on the record supporting the private health insurance programs in this country. Despite the scare campaign whilst in opposition by the current government, the membership of private health insurance continues to grow, which means for the private health insurance ombudsman, the workload continues to grow, and this bill would see that shifted across to the Commonwealth Ombudsman. We all know that the Commonwealth Ombudsman already has a huge workload in defence, immigration, law enforcement, the postal industry, overseas students, and potentially more things into the future. So it leaves us to question, what is the government's motivation for this change? Is it cost-cutting? And yet the legislation indicates it's cost-neutral. So we're left on this side of the House, where we demonstrated in government how to get the balance between business imperatives and consumer protection. We protected consumers for rising costs, and the private health industry provision grew. So we're left to wonder, is it to avoid scrutiny? Is this government avoiding the data that would help and assist in making provision decisions into the future? Acting Deputy Speaker, this bill demonstrates clearly that this government and this health minister have very different priorities to the previous government. They are not, it seems, interested in an effective, efficient, informed health sector, perhaps only more clearly marked by the Medicare local shambles that we've seen, where there is still no certainty and could be seen through the lens of another attack on collecting the data to make informed strategic decisions about the health sector. Acting Deputy Speaker, Labor has a proud record on health. We want private health insurance members to have access to quality information and the best resources so they can find the best provider at the best price. We want access to the best health system in the world. We want a healthy, productive community, investment in preventative health, keeping people out of expensive hospital beds. And it seems that with this piece of legislation, we put at risk some of the data and some of the information and some of the monitoring and some of the intervention that makes that possible. Deputy Speaker, this government, it appears, does not value health provision. It talks about competition, but fails to back this up with actions. It approaches health policy in a scattergun way. There's a lack of consultation with the sector or consumers. There's a lack of clear vision. Deputy Speaker, Minister Lay, it seems, has been sent in to clean up a mess that she's inherited by Minister Dutton when he was in the role. And my fear is this is another example of poorly thought out policy. For the people in my electorate, where 62% have private health insurance, this is a critical piece of legislation because it may, in fact, put in place or change the provision currently from the Private Health Insurance Ombudsman, where we've seen from the performance to date, consumers can be quite confident that they can make a complaint and have that complaint seen to seriously, that they can go to the Private Health Insurance Ombudsman with confidence that they are dealing with a system that knows the sector well, that has expertise in the sector, that they can talk to specialist staff who understand their concerns and understand the way this system works. So I'm reluctant to say that I could support this piece of legislation, given that it changes the shape of that situation as it is currently. Deputy Speaker, the substantive elements of this bill has a merger between the Private Health Insurance Ombudsman and the Commonwealth Ombudsman, but we're left wondering if there'll be the capacity for the Ombudsman to fulfil this important work. We're also concerned that at present the subject of a complaint may request additional time to report to the Private Health Insurance Ombudsman, and that this ability has not been transferred, that this ability does not go with the changes as proposed by the government. There is also currently provision for the Minister to intervene where the Private Health Insurance Ombudsman decides not to investigate a complaint, and this is omitted from this current bill. Also, the provision for the Minister to request the Private Health Insurance Ombudsman to undertake investigations, that is also omitted in this change. So, Deputy Speaker, like my colleagues, while not opposing the bill outright, I do want to flag the opposition's concerns about these omissions, and I want to do that on behalf of the 62% of the people in Lalor who have private health insurance and who need to have access to ensure that their complaints, that their consumer rights are protected in this system. And I find myself once again speaking in this chamber on health, concerned about this government's lack of direction in the health portfolio. We're still in a space where we are unsure about the provision of bulk billing into the future. And for the people of my electorate of Lalor, where 92% of people have access to bulk billing GP services, that is a concern. We're in a situation in my electorate where health funding for hospitals has been cut through last year's budget. We have a situation where we have another area where we have a 12 months continual funding that will finish again in June around the Macaulay Centre. And again, as I say, Medicare locals are still unsure about the future. We have general practitioners in the electorate who tell me that they found the Medicare local absolutely essential, absolutely informative around the data and the needs of the community they serve, that they had been working collaboratively across the electorate on preventative health measures and being innovative about how health provision would be conducted across the electorate. So, Deputy Speaker, I call on this government to start thinking clearly about health provision, to put preventative health measures at the front of their thinking in this area. I ask them to honour bulk billing into the future and to desist from trying to dismantle our universality in health. I ask them to fund the hospitals, to commit to ensuring that our public hospitals have the funds that they need. I ask them to fund preventative health measures. I ask them to give consideration to all of these things so that we can work in the health sector with the data that we need to ensure that we get provision right into the future, and so that we can keep people out of expensive hospital beds, so that we can work with our general practitioners, with the experts in the health sector to ensure health provision in my electorate and across the country is the best it can be, as it has been in the past, Deputy Speaker.
The question is?